Hello friends and welcome to the channel. I'm Dr. Mohsin Raj. I've done my MD from AIIMS New Delhi and now I'm a DM cardiology student at AIIMS Delhi. And this video is about the revision strategies that you should follow because the exams are coming. And first of all, let me point out why revisions matter. So imagine yourself in the exam hall, you have a question in front of you and you're not sure between two choices of an MCQ question. Therefore, you know that the answer is between one of these two choices. You know why this situation appears? The most common reason why you land up in such a situation is the lack of revisions. Okay? A topic that you've revised thoroughly, you're unlikely to be in such a state that you're not able to pick up between two options. Right? So let me answer a few questions about revisions that you might have in your mind. Number one is how many revisions are needed. Okay, so I have had very good ranks. I had All India rank 11 in PGI Chandigarh exam in PG. I had 16 All India rank in the AIIMS PG entrance. I had All India rank 1 in the NEET super specialty or AIIMS super specialty or PGI super specialty. So how many revisions do you think are needed to get top ranks? Now, let me tell you, higher the number of revisions, the better it is. So this is something that you need to be higher on. More the number of revisions, the better it is. But if you want to know the bare minimum for getting a good rank, it's, I think, 3 or 4 revisions. Yes, at least 3 revisions are needed for you to score good, for you to score some of the top ranks in these examinations, right? Okay, number one. Number two is, what should be your timeline? How to revise in the coming maybe 2 to 3 months, 2.5 or 3 months of time that is left for NEET PG or INICET. So how should you revise these things? Okay, so the thing is, remember, for the first month, maybe for the month of March, what you'll be doing before the INICET is you will cover up any pending work that you have, any pending subjects that you have, but at least half of the time you will devote to revising the previous term. And in the next month, that is the month of April, you are totally revising things. You're not reading any new books, any new review books, any new notes, any new video lectures. No, that's the time to reconcile. That's the time to revise things. That's the time to build on whatever you've learned previously. Maybe you might have spent one whole year of internship and reading things. Now is the time to revise it. So in the month of March, at least 50% of your reading time has to be devoted to revisions. In the month of April, all the time has to be devoted to revisions. I assume maybe somewhere in the middle of May or whatever in the June. I'm not clear about the date of the exam, but in the next 2 months, you should be clear. At least half of the time in the month of March, revisions, and full April month revisions. And I assume that you have revised this step at least once, and the next 2.5 or 3 months, you should be able to revise it at least twice so that you reach to the exam day with 3 complete revisions, right? Okay. Now, third point is what to revise. See, you might have read those review books, you might have read your coaching notes, you might have considered some standard books in other subjects, but what all do you have to revise now? Because I understand reading a big book is difficult. Say, for example, you may have to complete a subject in 5 days. Or that's too much. You may have to complete a subject in just 1 day. So what I'll recommend is that if there's a review book, say for example, for pharmacology, you've read GRG extensively, and you're sure that you will finish that up maybe in 1 day, maybe in 2 days, okay, it's okay to revise that book. Because I remember reading such books like GRG for pharmacology or the book for the PSM by Vivek Jain. Those books everyone reads, extensively, multiple times. It's easy for you to revise those books. On the other hand, if there's something that you've read just once, or maybe you prepared your own notes for that subject, it's wise to prepare notes. It's wise. So here comes the role of the notes that you might have prepared, right? You might have written some notes. You might have maybe copied notes from some student. You might have maybe prepared digital notes on your iPad or on your laptop. So this is the time when you have to revise those notes, okay? So that is something maybe someday you read a chapter extensively, then extracted some very useful points for the exam, and yes, this is the time to revise those notes, okay? Then number next, which I would like to highlight, is the role of tests. I've repeatedly told you in my videos that tests are an extremely useful way of revising things. So I repeatedly say that instead of opening the book again, reading the book line by line again, it is better to do a subject-wise test of that subject and do the answers of all the questions in that test. That's it. You will revise whole of the subject in those 200 or 250 questions of that subject in that test, which you'll appear in. Okay. So what I mean to say is that a subject that you have read thoroughly from a review book, revise that review book. What I said is that a note that you have prepared well during your internship or when you were preparing for it, while you were attending coaching, while you were attending maybe online classes, yes, revise those things. Whatever notes you have prepared, revise those things and give tests. Tests are very useful at the end of towards the end of the preparation. Now, a very important part of your question paper are image-based questions. So if you haven't done it so far, please do this from now, whatever I'm going to say. Whenever you read any subject, you feel there's an image which could potentially be in an exam, take a photograph or take a screenshot if you're reading from an iPad and store it in a folder. And at the end of each day, revise those images. So this, over the next month, over the next 2 months, you will compile a lot of information. I suggest you take photographs of important images. You take photographs of important tables so that 2 days or 3 days before the exam, you read that full folder. That will have over 500, 600 images. I had done it at my time. That would have 500, 600 images, tables, important things, so that you revise those things just before the exam. Okay. Now, number last is the volatile stuff. Please maintain a notebook which contains the extremely volatile part for preparation. Out of these 19 subjects, some are okay. You can remember facts from pathology. You can remember concepts from physiology or concepts from medicine, but it's extremely hard to remember, enzymes and reactions of biochemistry. It's extremely difficult to remember the name practice of orthopedics, or maybe the sections and other stuff from forensic medicine and toxicology, or something from social and preventive medicine. That is what you need. You need a separate notebook that contains all this volatile information, again, 1 day prior to the exam. So just before the exam, all you should be having in front of you are those photographs of the image, the tables, the high yield tables that you have read, okay? And second, the volatile stuff, the biochemistry, the forensic medicine, or orthopedic fracture. So all that stuff. So that gives you a finishing touch just before the exam. I hope you find the contents of this video useful. Good luck for your preparation. Thank you.